Androgens and growth hormone releasers. First of these supplements is androstenedione and androstenediol. These are prohormones that are precursors to testosterone. So if you look here on the right-hand side of the screen in this figure, you'll notice that we have several pre-hormones that could be used to basically produce testosterone. So they're precursors to testosterone. They have a very similar structure. They're produced endogenously and have this cholesterol plate base structure that then you have subgroups attached to it to produce testosterone. So they're very similar. So the claim here is that we can increase the amount of testosterone circulating in the human body, which would then theoretically increase muscle mass and also help with recovering from exercise. So what manufacturers try to do is provide these prohormones, these precursors to testosterone, and then also add aromatase to the mix to prevent that conversion of testosterone to estrogen. The fear here is that if you have too much of a particular prohormone, that it actually can be then converted into estrogen. So for men, that would be problematic because an increase in estrogen levels could mean gynecomastia or the development of breast tissue. So this is a concern in athletes. So as far as the efficacy and evidence is concerned, there doesn't seem to be any supporting evidence for the use of these prohormones in having anabolic properties, and it doesn't seem that the aromatase inhibitors actually prevent the conversion of these prohormones into estrone or estrogen. As far as the side effects are concerned, there may be a reduction in the amount of HDL cholesterol. This is what's considered good cholesterol that prevents atherosclerosis or cardiovascular disease. The increase in estrogen that may be experienced perhaps might increase in men the risk for prostate cancer. So it is a substance that's banned by the Olympic Committee, and in the United States as far as participating in sports is concerned. The application of this is 300 milligrams per day. So as far as growth hormone enhancers are concerned, we have secretagogues, which basically are substances that are going to promote the release of a secreted hormone, in this case being growth hormone. So amino acids are the building blocks of protein. There are 20 of them, and so the idea here is that we can enhance the secretion of growth hormone by simply ingesting more amino acids. They do occur naturally in foods, and of course we can have them in supplements. So if we can improve growth hormone release, then that means we can get an increase in muscular strength and perhaps even improvement in our cardiovascular endurance. As far as the efficacy and evidence is concerned, it seems that arginine, lysine, and ornithine, which are 3 amino acids, do seem to provide some evidence in increasing growth hormone. There seems to be more of a response in untrained individuals, and women tend to respond more to this regimen than men do. As far as overall diet is concerned, it seems that the higher ingestion of protein does tend to release growth hormone, and it also seems to be age dependent. As far as side effects are concerned, cramping might result, diarrhea may happen as well. The application of this really does depend on which amino acids you're consuming. Another secretagogue is exercise as far as growth hormone is concerned, and we're talking both about static and dynamic work here. So resistance training and cardiovascular exercise seem to be enhancers of the amount of growth hormone that is circulating in blood. The efficacy and evidence of this, well, there are several studies that are out there that show, for example, that 20 minutes of cycling at 600 to 900 kilopound meters per minute improves growth hormone. Strength training at 85% of your one repetition maximum also seems to enhance it. It does seem like, though, that you're going to get more of a response out of somebody who's untrained versus somebody who's well-trained. The addition of amino acids doesn't seem to enhance this effect, so it doesn't seem to have any sort of enhancement as far as that is concerned. Side effects, nothing in addition to the risks of exercise. So, of course, exercise always presents a risk to everyone who engages in it. However, there's nothing above and beyond here as far as exercise is concerned. So the application here, basically high intensity exercise that you sustain for 20 plus minutes.